Hello everyone, it's Vix. For those that haven't met me before or have just joined, I'm a yoga instructor and teacher trainer for a school in London and an osteopath, and I have a clinic down in Kent in the UK. And one of my greatest passions is to share the human body and teach the human body in a way that is understandable and helps people to use this knowledge in an applied way in their classes. So today is a short video on the foot, specifically the ankle. We're going to have a quick look at the bones, and then we're going to move into the two main joints that give us the movements at the ankle. So let me share the screen with you. Okie dokie. So here we just have the lower leg, a view of the anatomy of the lower leg without any of the tissues on there, just the bones. So here I want to zoom in a little bit and just show you the arrangement of the bones in the foot. So you can see that in the most distal or furthest away part of the foot, you have your phalanges, which are long bones that all come together to give you your toes. And then in the middle of the foot, we have these short bones, which we call tarsals. And these are the smaller ones in this midpoint of the foot. And then we have the two at the back, the talus, the calcaneus. That's the heel. And the talus is, as you can see, the bone that the lower leg articulates with to make the ankle. So from above, you have the distal part of your tibia bone and the distal part of your fibula bone. So these are what make up the first part of our ankle joint. So if I were to just get you to have a look at your own foot for a moment by popping a little bit of skin back on there. So if you were to look at your ankle from the front, the distal portion of that tibia and fibula come together with the foot bones at about this point here. And if you were to feel in the center around here, you would feel that soft, sort of squidgy feeling. And that would be where you can feel almost through to that articulation where the lower leg meets the foot. So let's go back to here. And zoom back in. So let's go back and build this anatomy. So the distal portion of the tibia and the distal portion of the fibula make up this mortise, which is a word that describes the shape that they make together, which is like a crevice or kind of a space where something can slot in. And you can see that bone here, if I highlight that in green, which is the talus, that one is the bone that fits snug into that mortise shape. And if I fade that out for a moment, actually, if I hide, you can see a bit better. You can see where the talus bone now fits into the ankle. So this is our first major joint that we get the action at the ankle. Let's unhide that. And let me show you now the talus bone. So this is a foot bone. It's a tarsal bone, which means it's a short bone, and it takes a lot of the weight coming through as a combination from what's coming up from the floor and down from the body. So that is your talus bone. So the joint that we're talking about here, and if I just draw it there with a very wiggly pen, that is the first joint. And I will just create a text box to write for you the name of that joint. That is the talocrural joint. Now, if I get you to remember your actions at the foot, you remember that there are a few actions that the foot does, the ankle in specific. And we're going to talk about these two, so dorsiflexion and plantar flexion. So that first joint that I've highlighted across with pink is the talocrural joint. It's a hinge joint. You can see if you were to take that talus bone and move it around inside that mortise, that shape that's been created by the tibia and fibula, you would see that it would have to go sort of forwards and backwards. And that is dorsiflexion and plantar flexion. But I won't leave you with just that. What I thought we would do is add the muscle that does the action so that we can learn and see that movement. And we're going to look at the tibialis anterior muscle. So this is the main muscle that creates the dorsiflexion, which is where we bring the top of the foot up towards the shin. So we call that in layman's terms like flexing the foot up. So if I zoom out a little bit and I ask the app to show us. So I want to zoom in a little bit here. So zooming in to the joint, the talocrural joint, as you can see, is moving up and down. And this is the sagittal plane. So the sagittal plane. And as you can see, the tendon of this joint, the white part that descends down, actually articulates here on the medial side of the foot. So that would mean, if you think about that mechanically, that there might be another action at this joint. And I want to show you that one as well. So if I go back, and you can see that also, we'll go through this again in a minute, but this is the second job of that muscle. It also will invert the foot. We'll come back to that shortly. So how do I get that? Got it. So we've had a look at the talocrural joint, and we now understand that the talocrural joint is an articulation between the end of the tibia, the distal tibia, the end of the fibula, the distal fibula, and the talus bone, which sits, if you press into the front of that soft part, front of your ankle around here, you would feel you'd be able to feel almost onto that bone. So if we have the dorsiflexion, then we need to find out how we do the plantar flexion. So I'm going to pick out one of the main muscles that does that. So in the back of the calf, you have the soleus muscle, which is now highlighting itself as it contracts, and that moves that hinge joint into its plantar flexion. As you can see, the heel lifts and the foot goes down. So that is plantar flexion. So we've covered the talocrural joint and the two movements that it has. Now, when we get more into the advanced anatomy and movement of this joint, we do sort of learn the degrees of motion in different ways. When we look at how that joint slides around in itself, it does have some degrees of motion in other directions, but for the most part, when we first learn the joint, it is good to just stick with the dorsiflexion and plantar flexion and not focus too much on the degrees of sort of side bending and rotation that it does. It's enough for now, if you're learning this as a refresher or the first time, just to know that it's dorsiflexion, plantar flexion in the sagittal plane. And that is the one of the two joints we're going to cover. So I'm going to come around now and I'm going to highlight the calcaneus, and we're going to hide the calcaneus, and I'm going to zoom in. So this is the right foot. And if I look and get you right underneath. So that is the cartilage there where the calcaneus articulates with the talus. And that is the surface on which we get the next joint and movement, and that is the subtalar. So I'll write that down. For you, subtalar. Sub meaning underneath, talar meaning talus. Zoom back out. So I'm going to move on to the other ankle because I'm finding it tricky to get the calcaneus to go back on. So there we go. There is our calcaneus. It's also a tarsal bone, but it's a big one compared to if we come round and look at those shorter bones, the smaller bones in the midfoot. So the calcaneus is the heel, and it's this joint. It's this bone that creates this subtalar joint. Now, if I'm making a big mistake here isolating it in case I lose it, but here we go. There is a lateral view, posterior view, medial view, superior bird's eye view. So you can see that surface there, the white surface there, is where it articulates and moves with the rest of the foot. And perhaps not as easy to see, but if you were to move the rest of the foot, at the talus, for example, if you were to move the rest of the foot around on that joint, your foot is going to move, the sole of your foot will move either in towards the center or away from you. So think butterfly pose or soles of feet together. Or for some of you, it might be think ankle sprain. When you've rolled your ankle, that's inversion. And then when the foot goes out to the side, that's eversion. So the two movements, inversion and eversion. An easy way to remember those is in, bring the sole in. Version, so inversion, and then eversion is out. So let's have a little look at the muscles that give us the movements here. So I've highlighted the fibularis longus muscle here. As you can see, if I zoom out and reorientate you, you've got the lateral knee, so the outside knee, and it comes all the way down. If we zoom in and look at where that tendon runs through the outside of the ankle and down, and then plugs right up onto the edge of that fifth metatarsal there. So if I highlight your muscle and we get it to evert the foot, you'll have a quick look. Now, please really have a good look at where that joint's moving. You've got your talus up here and the calcaneus. See how the foot's moving. So if I zoom out to give you a nice look, you can see and go ahead and feel that on your own lower leg on the outside. When you evert, you can just feel that muscle moving. Lovely, and we're almost there. We've covered both of the joints. So just to give you a recap on the subtalar, it is the articulation or the coming together or meeting of the talus, the calcaneus, and that's where the action of that joint is created. It's called subtalar, and it creates inversion and eversion. Let's have a look at inversion, and we already have the muscle ready to go because we looked at it earlier as well. And again, a reminder that if I highlight tibialis anterior, you can see in yellow here, the tendon runs across all the way to the base of that first metatarsal. So the metatarsals are the long bones here in the middle of the foot, 5. And if you think about it, if you were to take a stretchy band and take it from your knee up here at the top of that muscle and cross it over your foot onto the inside of your foot here, and then you were to pull that stretchy band, you would be aware that the foot would turn in a little bit. Let me demonstrate here. Inversion. So you can see as it's pulling on the inside foot, it inverts. And there we have it. We have the talocrural joint and the subtalar joint, the two main joints of the ankle, creating the 4 main movements: dorsiflexion, plantar flexion, and inversion and eversion. Thanks, everyone. I'll see you soon for the next lecture where we'll go through the ligaments and some other muscles of the ankle and foot, and we'll also look at the injuries that occur in the ankle. See you soon. Thanks very much.